many women going through menopause complain about and sometimes even joke about some of the most obvious symptoms like hot flashes and mood swings.
But one of the more private symptoms of menopause is no laughing matter, and it can significantly affect your marriage and overall quality of life.
Dr. Herbert Cousins is an obstetrician and gynecologist here from Bellin Health Generations with a new option for painful intercourse that is caused by menopause. It's called the Mona Lisa laser. Good morning to you.
Good morning.
Well, let's start with a conversation about the treatment options, but why is this such a huge issue for people? How common are these problems?
Virtually 100%. So when women go through menopause and they lose estrogen, estrogen is a steroid hormone that causes tissue growth. And when the vaginal tissues stop growing and get weak, they're thin, easily damaged. They cause symptoms like burning, itching, urinary problems, problems with intercourse.
So what is the average age for women to go through menopause?
Usually around 50. There's a range, late 40s to early 50s, but we say about 50 years old.
Okay.
Well, we mentioned hope. Let's talk about those treatment options.
Right, so specifically, estrogen treats everything, the hot flashes, the night sweats, the vaginal issues, the bone health. But some women don't have all of the symptoms. They are really troubled more by the urogenital symptoms. And the Mona Lisa targets those symptoms particularly.
So how does the laser work?
It's actually quite amazing. Since we first talked about this a few months ago, we've done over 100 patients.
Wow.
Virtually 100% of the patients have had relief immediately. The initial treatment is 3 series. Okay. Each treatment is really only about 4 to 5 minutes, and each treatment is done about a month apart. So over about 3 months, patients get almost immediate relief.
Wow.
And what are some of those immediate benefits?
So the skin actually grows. The laser stimulates the skin to grow, mucus production, collagen production, elasticity of the vagina, so the burning, itching, and problems with intercourse are relieved.
Are there any side effects from this treatment?
Almost none.
None.
It's incredibly safe. It's done completely awake, just a little topical anesthesia, right back to the day it's an office visit.
Oh, so you can go back to work or whatever it is you might be doing.
Right.
Wow.
And you mentioned in the notes that you gave us, this is also an option for women who are breast cancer survivors. Talk a bit about that component.
Right, so they're even earlier. So we talked about the average age of menopause, about 50 years old. But a woman who has premenopausal breast cancer may go through a complete hysterectomy and remove the ovaries in the 40s, early. And they have really much less options as far as estrogen replacement.
All right, so you mentioned there's quite a bit of demand for this procedure in the Green Bay area. How do we kind of get involved? Do we call you guys directly?
Right.
Do we need a referral?
No referral,
Okay.
It's self-referral. Because insurance doesn't cover it, it is a cash-only procedure.
Sure.
So insurance is not a barrier to referral at all.
Okay.
There is an open house coming up in February.
Yep.
And so if you want to learn more about it, definitely come and hear a much longer presentation.
Sure, and that's February 5th, and you can find more information at bellin.org/calendar.
And if you're looking to make an appointment right away, here's the number for that, 920-338-6868. Thanks, Doctor.
Thank you, guys.
Here's Jordan.